My name's Anna Collins, and this is my daughter Simone, and she's 17 months old.
My name's Olivia, and this is my brother Nikolas, my two sisters, and my parents.
About 3 years ago, when Nikolas was having some serious health issues, we found we needed to use the palliative care services at the IWK.
I used palliative care while I was pregnant. I believe 28 weeks was when I had my first appointment with them, right up until we left the hospital when Simone was 2 months old.
Palliative care is a specialty of medicine where we really look at the patient as a whole and where we try to maximize comfort and quality of life. One of the main role of palliative care is making sure that the moment of wherever we are on this journey is lived to the fullest. Some people will equate palliative care to end-of-life care, which is actually part of the work that we do, but palliative care is a lot broader than that. So any child that is affected by a life-threatening or a life-limiting disease can benefit. The most common link between all our patients is that there's a very high level of uncertainty. So many of them have very rare condition for which we really don't know the outcome.
At my 20-week ultrasound in Charlottetown, they were having problems seeing Simone, so they asked if I would like to return in a week or if I would rather go over to the IWK. Of course, I wanted to stay here on the island. About an hour and a half after leaving my appointment, my nurse in Charlottetown called and said they had an appointment set up at the IWK. When we arrived in Halifax, we had another technician do the ultrasound, and that's when they told us that the ventricles actually were in her brain that had been enlarged, so there was pressure. She had 4 holes in her heart. As well, there was a contracture in her foot, meaning that her foot was up at an odd angle.
The Pediatric Palliative Care Service sometime will be involved antenatally with mothers and fathers, of course, but we'll meet the parents antenatally when there's concern about the baby. When we met with Anna, so mom, she had a lot of questions. There was a lot of uncertainty about Simone's condition. We really didn't know what she would like or what she would be when, at birth. And so we went through the whole spectrum of possibility, from being born alive and living to not even being born alive.
The whole time that I was talking to palliative care, it was before I had Simone. I kind of put it off to my mind that I wasn't talking about my child. It was just in the event that a child were to pass, what are some of these options? Because you can't really let your mind go to the fact that the child you're carrying might not make it. But it is tough to lay at night and feel a baby inside you and wonder, all these things. But they were able to answer those questions that I wasn't necessarily prepared to hear the answers, but I know that hearing them before she was born in the long run helped me get through the rest of the pregnancy.
When Simone was born, she was actually quite vigorous and fairly good.
Simone was born with a chromosome abnormality. At this point, they can't tell me what that means for Simone as far as her developmental delay. She had her heart surgery, everything's been healed. She had to have one of her legs casted due to the fact that she had the contracture, but that has healed nicely and she's learning to walk. I'm just so proud of the way that Simone has turned out, and she's just doing so much better than anybody had anticipated. Palliative care was there for me, whereas all the doctors and all the nurses were there to take care of Simone and to ensure her best interests were met. And palliative care was a huge support and comfort.
Palliative care is really a mix of multiple disciplines, and it's probably why we work so well as a team also, because we really need more than just medicine. But we often compare it to being about a quarter social work, a quarter psychology, and a quarter nursing, and a quarter medicine.
You're full of Leah, mister.
Nikolas has cerebral palsy, and he also has hydrocephalus. And he's got a cortical visual impairment, which impairs his vision.
Basically, it's a lack of communication between your eye and the part of your brain that processes your vision. So his vision can be a little jumbled, and for him, he has difficulty making out complicated shapes like faces and stuff like that, but he can spot an M&M from across the room, so go figure that.
About 3 years ago, Nikolas had a fairly significant illness, and his health and his life was compromised, and it looked like he could have had a life-threatening sort of issue happen.
He got into some issues with pressure problems in his head, and he was having a lot of pain issues, and he was seeing some surgeries. That we started talking to the folks at Palliative Care, and basically about the pain management and you know, what to do if the worst happens, sort of thing. So we found them really helpful, nice people.
We eventually find a mix of treatment that were actually relieving the episodes when they were happening, and we could manage the episodes at home, which made the world of difference being at home compared to being here far from his family.
We could call them at 2 a.m. and get some help. And when you've got a child who's in extreme pain, it's nice to be able to pick the phone up and say, you know, this is kind of what we need, or this is what's going on, and how can you help us, sort of thing.
They were available all the time. I remember one time I called Dr. Gregoire and actually interrupted a bike race, and she stopped to take my call, so that was nice.
We were very happy. He ended up getting much better and back to do all sorts of crazy things with his family, like downhill skiing and all sorts of things.
Palliative care is a wonderful place for you to go if you have questions. They really are there for your best interest. They're comforting, they're easy to talk to, they have a peaceful quality about them.
They're there to make whatever situation your child is in best, and how to make the most of what their life is like.
Even when you do get bad news and uncertain news, that, you know, with optimism and a wonderful team at the IWK, that, you know, you can end up having a wonderful child like Simone.
I understood palliative care to be more from an adult situation where it's strictly end of life. And it pretty quickly came to me, especially when the doctors and I met, they said, you know what, it's not all about end of life. It's not about how someone is dying. It's about helping people live the best they can and giving them the best quality of life that they can have in the time that they have.